As a sheriff, I wear two hats. One, leading a law enforcement agency that responds, is the tip of the spear, that responds to this threat, investigates this threat, enforces this threat, takes part in education, outreach. Also, as a correctional administrator, I also supply crisis intervention for inmates and drug counseling, which we partner with Walden as well.
I'm also a product of the 60s, and I worked in a methadone clinic early in my career, and the faces of heroin addiction were very different. They were middle-aged, white and African-American, inner city. That's no longer the face of addiction for opiates. So, opiate addiction in St. Mary's County, it's particularly an issue among the 18 to 30-year-olds. Admissions for treatment for opiate substance use has increased 400%. So, as I said, I've worked in this field a long time. For the first 30-plus years, we didn't see heroin, and I was grateful for that, having seen that up in Prince George's County when I was a young college graduate. And then the tide started to change, and that is now predominantly what we're seeing.
Crack cocaine became secondary to prescription pills over time, which introduced opiate medication to our illicit users. Next slide. In 2007 and 2008, we were in the midst of a drug epidemic that peaked our prescription overdose deaths at 17. 17. That's unbelievable. But do you remember in 2007 and 2008? There was no conversation about this. There really was nothing in the media. In fact, Kathleen O'Brien, who's with me here today, we were interviewed by a member of the media, and they wanted to know about homicide rate, which had gone down. They wanted to know about other crimes, which had gone down. I brought this up. And they said, yeah, but that's prescription medication. That's given to people by doctors. And that was the common reaction at the time. It's legitimate if it's prescribed. Not to mention the fact that then there was illicit obtaining of medication or drug diversion that was going on that was changing law enforcement.